Hi, I'm Brad Storm with Premier Plastic Surgery along with Dr. Moore and Gonzalez. Today's short video blog is on mastopexy. Mastopexy is simply a breast lift. Breast lifts are performed for breastosis, P-T-O-S-I-S. Breastosis is a pretty simple concept. If you stand in front of the mirror, straight up, shoulders back, and you put your finger at the lowest part of the fold under your breast, and you draw an imaginary line straight through to the front. If your nipple is above that line, you don't have ptosis. If the nipple is at that line, then you have level 1 ptosis. If the nipple is below that line, you have level 2 ptosis. And if the nipple is the lowest part of the breast, you have level 3. There's another concept called glandular ptosis, and that means the nipple's where it belongs or close to it, but the volume of the breast, the gland itself, has dropped low, and the nipple's where it belongs, so it's not strictly speaking a descent of the nipple. Now there's two places this comes into play. One is the patient who comes in wanting a breast augmentation. If you want a breast augmentation and your nipple is level 2, below the fold, or the lowest part of the breast, then I can't just put an implant in there, because the implant would do one of two bad things. One, it would stay up high and the breast would just fall off of it. The second thing that could happen is that the implant would just slide down into the breast, creating a really bad look. So if you're in that circumstance, you need to have a lift at the time of your augmentation. Sometimes surgeons like to split it up and do just one and then the other, but I'm very comfortable doing both at the same time. If you have level 1 ptosis, where the nipple is at the fold, then you may be a candidate just for an augmentation. It depends on what your goals are, what implant you like, your measurements, and we'll sort that out in the office. The second circumstance is when a patient comes in and says, I don't like the shape of my breast because of the drooping. If that's the case, then you have one question you need to answer, and that is, when your bra pushes your breast up, gathers it where it belongs, if you're happy with that volume, then you don't have to have an augmentation. We can just do a lift. And in that circumstance, at Premier, many times we will take the lowest part of the breast, the part you find most objectionable, isolate it from the rest of the breast, but still leave it attached, and move it up to where you want that volume on the high side, and then we raise up the nipple and the areola at the same time. This is a more long-lasting result because you're not just relying on the tightness of the skin to keep the shape. You're actually rearranging the breast to make the most objectionable part take a spot in the place where you want it. Now, our scars here at Premier are usually just around the areola, and then a variable vertical distance, sometimes with a little hitch at the bottom. The way we do mastopexy for most patients is a way that takes away that whole scar underneath that a lot of surgeons are still using. Now, let's say you want more volume. You've done that test where you gathered the breast up and you know that's not enough. In the old days, there was only one option, and that was implants, and that works fine most of the time. The other option nowadays that's not really brand new is the fact that we can liposuction someplace, and at Premier we use a system that's special called Body Jet. It takes the fat in a way that's more gentle to the fat so that it can take as a graft. And what we do is fat grafting. We take your own liposuction fat, taken from a place you want it, and then we filter it, we concentrate it, we wash it, and then we inject it back where you want it, in the breast or, say, buttock, other areas where you might want volume. And that's a way to get volume into the breast in addition to that lift to get you where you want to be. So that's mastopexy, ptosis, and fat grafting. I hope this answers some questions for you. If you have questions, Come in the office, we'll talk about what you want to achieve, do your measurements, see what's right for you. I'm Brad Storm, Premier Plastic Surgery. Thanks for watching.